Hi guys. Using marijuana to treat heroin users, the idea appears to be gaining traction among people who helped craft Ohio's medical marijuana law. WLWT News 5 investigative reporter Todd Dykes is live with reaction to adding opioid withdrawal to the list of conditions that qualify for medical pot.
Yeah, Molly, while we're still about 10 months away from the launch of Ohio's medical marijuana program, there's already talk of expanding that list of qualifying conditions. But both a recovering addict and a doctor I talked to today say using pot to treat opioid withdrawal makes very little sense. As a recovering addict, Tyler Schmidt doesn't see how Ohio's medical marijuana program would help people trying to kick a heroin habit.
So I've seen a lot of close friends of mine, peers of mine that have sought an easier, softer way through marijuana, and ultimately I've seen a lot of that lead them right back to their drug of choice.
I spoke to Schmidt about the idea of using medical marijuana to treat opioid withdrawal after Jimmy Gould brought the subject up on Friday. Gould served on a task force that helped Ohio lawmakers embrace marijuana.
I believe we have the absolute best medical marijuana law in the country. It deals with pain, it deals with 21 listed conditions. It should be dealing with 22, including opioid withdrawal.
But Dr. Deborah Frankowski, like Schmidt, doesn't see any place for pot in addiction treatment.
The reality is we have no good science that says it's A, efficacious, and B, safe.
Frankowski treats people battling opioid withdrawal at the Center for Addiction Treatment in the West End. She worries patients in Ohio are making assumptions about marijuana that may be incorrect.
People think, it's this natural, organic, safe thing. We have no idea.
Until or unless marijuana undergoes clinical studies, both Frankowski and Schmidt will remain highly skeptical of the drug.
A lot of times in the recovery community, you hear about people talking about this marijuana maintenance program. It's kind of like a joke because it really don't work.
And if we're going to call marijuana a medication, we need that data.
Well, I also talked to State Representative Kirk Schuring today. He's a Republican lawmaker from Canton, and he served as chair of Ohio's medical marijuana task force. Schuring does think the state should consider adding opioid withdrawal to the conditions that can be treated with medical marijuana. Todd Dykes, WLWT News 5.